Hello and welcome back to the Healthcare Uncomplicated YouTube channel. Make sure you subscribe to the channel, click the subscribe button and check all the previous content there. Amazing content, amazing guests every week for you. Today, let me go and introduce you to Jorge Armanet. He's an entrepreneur, operator, investor and advisor. Jorge, how are you?
Very well. How are you? Thank you for having me here.
I'm doing really good. Thank you so much for accepting my invite. So I'm delighted to have you here.
Pleasure. Let's do it.
So the topic today is sustainable business models in healthcare. And the first question that I have for you is, can you tell us about your experience at Health Unlocked, building the biggest health community?
Sure. Well, it was a big part of my life, both professionally and personally, because I spent more than 10 years building the company. I think through that process, we started in 2010, 2009, really. So we saw a lot of things happening in digital healthcare. We saw really digital healthcare to be born. So in that period, we were able to explore how the healthcare system could look like if you reconfigure them with digital technologies. Obviously, it has been a lot slower than what everybody would want, probably, and than what people thought at the time. Because healthcare is a very complex industry. Your podcast is about uncomplicating it, but it's a very complex industry for various reasons. So Health Unlocked was, for those that don't know, it's a social network for healthcare, for patients, basically connect people with other people with the same health and well-being needs. And then it hosts the conversation. It has information and content with for over 300 conditions. Those conversations happen about those conditions and well-being topics in communities. Each community is managed by a real patient organization or a patient advocacy group in the US. So it's actually the largest network of patient organizations as well, I think, in the world. And it's all about patient engagement. It's all about giving value to patients for the time in the platform. And the value is given to them through peer support primarily. But the platform was also connected with primary care and secondary care.
Brilliant. And you've done so well. You really built the largest health community. It's such a great business model there with the engagement, the peer support, and patient to patient. Lots of innovation. I know it didn't happen overnight, but you've done extremely well over time. Moving on, can you suggest sustainable business models for digital healthcare companies?
Well, I think it's I think I think we're really just beginning to see models. I don't think, and I wouldn't say I'm an expert, but I've been in the space for a while. I don't think that digital healthcare businesses have yet succeed in building really successful, profitable companies. And I think one of the main reasons is that I think it's a bit, I'll try to explain, but I think digital healthcare has been kind of misunderstood as a subset of the traditional healthcare. So as such, it has been challenged to operate in the economics of the traditional healthcare. That is the economics of healthcare, of healthcare providers and payers around healthcare professionals. So, but that's how healthcare has been working, but it's not necessarily how healthcare could work with digital. If you think, for example, in other industries, Uber, for example, you wouldn't say that Uber is a subset of the taxi industry, but it's more a reconfiguration of the mobility service industry. I think in the same way, digital healthcare is not a subset of pharma or the providers or the payers industries, but more a reconfiguration of healthcare industry, of the healthcare as a totality of healthcare. So if you think like that, and I'm getting to your question, I don't want to get too philosophical as well, but to understand how a new reconfiguration of healthcare can happen, you kind of need to understand what are the roots of healthcare. You have to ask yourself, what are the roots of the system, the very, very basic roots, like the minimum common multiple of healthcare. And I think we could agree that two units are very important, which are patient experiences, so how patients perceive their healthcare, both the actual feeling and the services that we provide as healthcare workers. And the other are the biology of people. So biology and experiences are critical. And then those two things are not the healthcare professionals, are not the pharmaceuticals, are not the providers themselves, are actually the people. And that was kind of what Health Unlocked tried to show in all these years, which is people engage with healthcare from a humane point of view, from their daily experiences. So those that are closer to patients as people are probably closer to the most successful business models to deploy the battery of new things that we can do today, both in scientific medicine and in technology. So who are they? I think just going more to the actual concrete things. I think it's closer to the pharmacist side of things. And pharmacist, I mean essentially something more distributed through the community. If you see, for example, what Amazon is doing, which is integrating into an online ecosystem, pharmacies, virtual healthcare capabilities, primary care organizations, what they are actually building, I think, is a healthcare system, a digital healthcare system, a digital healthcare plan that will have components of analog healthcare, but that's going to be the satellite, not the other way around like digital is today. Digital is today the subset. I think digital is actually the whole ecosystem. And then you have satellites, which are more analog stuff, like traditional stuff. And then you can build companies and business models more with that thinking. Another company that has done something, a known company that has done similar things in the last decade, I think, is the case of 23andMe, for example, on how do you think how to approach medicine and healthcare from a consumer-facing or a consumer-centric, patient-centric point of view. In their case, which is an obviously very well-known case, they would first build this technology and this consumer-facing product that allows them to build a very, very large data set that hopefully will give them insights to, find new relationships in between diseases and genes. But then they created a company that can actually produce drugs, a pharmaceutical. And then they've been acquiring, telehealth and health provision capabilities. So you start as a consumer facing and you start going more into, and you start getting the more scientific parts of the things that you need to provide, like doctors, etc., as a kind of an add-on to a more consumer-centric thing. And just to finalize with the pharmacy side, so they really offer today. I'm talking about community pharmacies and online pharmacies in general, but I'm talking really about distribution channels for everything that is now available. Pharmacies today, they definitely can be the first point of contact for chronic condition patients, for common conditions, for some diagnostics. And then they can do more. They can use more digital stuff for things like nutrition, coaching, population health, prevention healthcare. So once you have that blueprint, that footprint, like Health Unlocked again, that you have millions of people engaged to your shops or to your website, then you start offering the rest of the things. You start creating personalized journeys for patients. And you can deliver on those personalized journeys because you don't own everything. You are an orchestrator of the different services that are available, including technology and services. I don't know if I went a bit uh, too much, but I don't know if that makes sense to you.
George is brilliant. I mean, you mentioned so much there. You mentioned, of course, before healthcare is complicated, very complex. I'm here to try to fix healthcare and explore all the biggest challenges and talk about everything, anything and everything. That's my mission and my goal on the show, to bring together, I mean, all the voices and leaders like yourself. But you mentioned something really peculiar, which is um, healthcare is digital health is kind of a subset, and it should be in that sense. And healthcare is misunderstood. And one of the things that makes healthcare complicated is demystified sometimes the terminology. I'm not a clinician, but I'm an entrepreneur in healthcare like you, and I've been around for a while. I've seen it all, and sometimes it's about communicating better, understanding the patient, understanding the interaction, about the digital solutions. You mentioned so much, and you gave some concrete examples about how to approach the consumer from a bottom-up approach, if you like. So that's fantastic. Moving on, George. The next item, we're coming to the end, but this: what do you think is the greatest challenge for digital health early stage companies?
I think related to what I'm dedicating myself now, I think it's actually the economic model of healthcare. Um, we've been waiting for a value-based healthcare system for very long. That means a healthcare that actually heals and is paid by for healing, not for providing time or interactions necessarily. And it's very difficult to do that because the system is so complex, is so intricate that you have a way in which money flows that is very non um, suitable for the needs of the new companies. One thing that is very important is that I think in this, and I've seen this as a startup, and then now working with very large companies like Moderna or Triton, where you are working at the large scale. And the problem is that when you're a startup, yeah, you think that you are everything because you have a lot of traction, some stuff, but really it's difficult that the small companies can make a sustainable business model on their own. So you need ways of orchestrating and consolidating different capabilities so you can produce a sustainable, healthy P&L, cash flow. And I think with what we're seeing today in the markets as well, the valuation of the companies, the interest rates, how that is going to hit VCs and startups, that will force the industry to consolidate more at early stages. And I think actually that is something that is good. It will cut valuations, it will make some people unhappy in that sense, but it might produce better uh, companies that can actually navigate for longer, not because they have great funding, but because they have a great business model.
Mm.
And I think that's very important. Finding business models now for early stage companies, I think goes hand by hand with attaching yourself to bigger business models, to bigger investment thesis, not just your own company thesis.
Brilliant. I think this is such an important point, because what we've seen, and you have more experience in here than me, is the companies raise money and then try to do something with the money instead of exploring these potential new business models for at the beginning for a sustainable way of delivery with larger partners. Partnerships are the way forward, as we know.
Yeah.
George, we come to the end of the episode. It's been great, fascinating. You deliver a lot of great food for thought and insight and experience and so much. I have one last thing to ask you, and we could spend 1 hour or two on this question, but is how can we make healthcare uncomplicated?
Um,
Try to be brief.
I don't know. I don't have a clever answer. I think I would just say that healthcare is how people live. So we just need to give more of the healthcare system to the people, more self-care, more prevention, more education, more people with the right tools to take decisions and spread those decisions and be responsible for those decisions. I'm not taking the healthcare professionals apart or anything like that, but there is a lot more that can be done in self-care.
Brilliant. That is such a great way to end. You know, I'm an advocate of wearables and self care, and the missing link. And I've been in health and wellness and healthcare for a long time, and the missing link is always this kind of health education. Is not enough. Not enough education for the clinicians, for the patients. This comes up all the time. George, I appreciate your time. Thank you so much for joining us, and it's nice to see you, and thank you so much for accepting my invite.
Pleasure. Thank you very much. Nice to see you.
Brilliant. I'm going to round up now to all our viewers and listeners. Make sure you subscribe to the channel. Also, I'm going to post George LinkedIn here and socials. Connect with him, ask him questions about his work and about his great experience and expertise. And also check all our partners working with the channel. And I'll see you all next week.